right, good evening, everyone. My name is Joe Durant. I'm one of the senior instructors for the Center for Pain and Stress Research, and tonight we're doing a tutorial on the Dolphin Neurostim. So if you have one handy, please do grab it. It's going to be a busy evening for you guys. We're doing an hour and a half of tutorial, so an hour of it's going to be instruction, and then about 30 minutes of it is going to be question and answer. So if you have any questions, do type them in the chat box, and I'll get to them towards the end. And maybe we'll have time for you guys to unmute your microphones in and ask some questions as well. So we're going to be going over all the features of the Dolphin Neurostim tonight. We're going to be going over how to find points, how to release scars, and how to hook up your vagus nerve stimulation. This is a very short period of time for this tutorial. I teach whole 2-day classes on any one of those topics. So we're going to get through this as thoroughly as possible as we can tonight, but you guys will get a link. So in the next few days, watch your email and you'll get a link and you can actually come back and watch this tutorial over again as many times as you want. So if you miss something, don't worry about it. It's being recorded. But on that note, this is being recorded. So you might want to make sure your microphones are muted, because anything you say or any noises in the background actually become a permanent part of this recording. And we've had some odd things get recorded on these tutorials. So you might want to hit the mute button there. And you're also going to get an invitation to join our Facebook forum. So look for that in your email over the next few days. Things are a little backed up right now with all the Black Friday stuff that we've been dealing with. So do be a little patient on that. I promise you guys we'll get it. All right. So without further ado, if you have a Dolphin Neurostim, now is a good time to bring it out. So we're going to go over all the features of the Dolphin Neurostim here. I see somebody's cat is helping out there. I guess that would be Stephanie's cat. That's why I do these things at the office. My cat and my dog would help out too. All right. So starting at the tip of the Dolphin Neurostim, you have a biocompatible alloy tip. If you push on it, you will notice that it is spring-loaded. Because it's spring-loaded, when you clean these, you want to use just any type of alcohol wipe. That will be fine. What you don't want to do is pour any liquid down in there, because it can get down here and cause some corrosion and interfere with the conductivity of the conductive medium that's down in here, okay? Moving up from there, you will see there is a black button right here. And you notice if I push on that black button, absolutely nothing happens. And nothing will happen until I turn the Dolphin Neurostim on. And so we go farther up the Dolphin Neurostim, there's a roller switch right here. And you can see that it is marked both on and off and high and low. So this roller switch will do 3 different things for you. It will allow you to turn the Dolphin Neurostim on. It will allow you to adjust the intensity of the stimulation. It's also going to allow you to test the battery, and that's a really important feature. So I'm going to demonstrate what should happen and what shouldn't happen. So when you turn the Dolphin Neurostim on, there should be a nice bright green light like that comes on. But if you turn your Dolphin Neurostim on and you get a sound, but you don't get a green light, that means you need to change the battery, okay? And the reason I point this out is the number one reason we get customer service calls is people call and complain that their Dolphin Neurostim isn't working properly. And 99% of the time, 99.9% of the time, it's because the person's battery is dead and they need to change it. So if you turn your Dolphin Neurostim on, the very first thing you're always going to do is look for that green light. If you don't see a green light, stop and change the battery. So since we're talking about batteries, I'm going to show you how to change the battery in the Dolphin Neurostim. So to do that, you can use a coin or a pocket knife or whatever you want. And if you look on the back of the Dolphin Neurostim here, you will see that there are 2 screws at either end of the Dolphin Neurostim. So whatever you do, do not take these screws out. If you take these screws out and try to pull this thing apart, pieces will fly everywhere. It will void your warranty. And if you can find the pieces, you have to send it back to us for us to put it back together. So please don't do that. For your convenience, there's a battery compartment door right here. We really suggest you use that. So you're going to take your coin or your pocket knife or your screwdriver and put it in the little slot right here and pop that battery door open. Inside, you're going to find a standard 9-volt battery. You will notice that this happens to have a Duracell battery in it. There are 2 other batteries we recommend for the Dolphin Neurostim. We recommend Energizer batteries, and we also recommend Panasonic batteries. So of the alkaline batteries, these are the ones we recommend. And I know it sounds odd to recommend a particular battery, but in the world of 9-volt batteries, it's really a little strange. All AA batteries are the same. All AAA batteries are the same. C batteries, D batteries, you name it, they're all the same, except for 9-volt batteries. They come in different lengths. Some are a little bit shorter and some are a little bit longer. So if you look, in the dolphin neurostim, you'll notice there are no wires that connect this to the inside of the dolphin neurostim, like with most 9-volt battery devices. So if you put a battery in here that's too short, it's going to rattle back and forth in here, and you're going to get intermittent contacts, and it's not going to be a good treatment for you guys because only a portion of the time you're going to be doing a treatment. But if you get a battery that's too long, you will notice that there is a plastic post right here. And if you put a battery that is too long and jam it up against that post, you can actually crack that post, and it affects the integrity of the device itself. So if you stick to those 3 kinds of batteries, you should be good. So we're going to get let's see, an Energizer battery here. There's a little chart in here that shows you how the battery goes in. We're going to follow the chart. With the door open, I'm going to check my battery. I have a nice green light and a nice solid tone. You can see the light green there. So now that I know that it's a good battery, I'm going to put my battery door back on. This is a very tight fit. It's going to feel like you're going to break this, and it's going to make a loud snap, but I promise you it doesn't break. It's meant just to hold that battery in very, very tight for you guys. All right. So now that we have that sorted out, we have this nice on and off switch. You'll notice that it does roll. So the more you roll it, the more intense the stimulation is. So while you're doing a treatment, you can actually roll this to increase or decrease the strength of the stimulation. When you hold the Dolphin Neurostim, you want to hold it so that your thumb is on this metal plate right here, and we'll get to that in a minute. And your middle finger hovers over this little black button right here. When I depress this button, you'll notice that the Dolphin Neurostim beeps. If you flip it over, you'll notice that it also blinks, although it's not going to blink all the time, so don't pay attention to that. So as long as I'm holding this button down, I'm doing a treatment. So when I first turn the Dolphin Neurostim on and check my battery, the Dolphin Neurostim is in what we call search mode. And so in this mode, this allows you to actually find myofascial trigger points, motor points, and acupuncture points. But as soon as you push this button down, you are now actively doing a treatment, okay? And that treatment will continue until you release this button. You can't just push this button and expect it to go. You actually have to hold this down. All right, so moving up from there, you'll notice there's a little tiny black button right here, and this is your continuous treatment mode. So this actually puts the Dolphin Neurostim in a silent continuous treatment mode. So you don't have to hold a button down if you push that. So I'm going to turn the Dolphin Neurostim on, again, trying to get you guys used to checking the battery on it. And I'm going to push this little black button, and you'll notice that the Dolphin Neurostim makes no noise whatsoever. You'll see that it is actually flashing. So it's continuously running. So if I were doing something like vagus nerve stimulation, this is a very, very useful feature. And if I'm also doing scar release or doing like some suture release in the skull for concussions or something like that, that's a feature that's going to come in handy for you guys. Now, when it's in this mode, you cannot find acupuncture points, motor points, or trigger points. So you do need to be holding it in one place or actively trying to release a scar or something like that. All right, so this will run for approximately 14 to 15 minutes. After it times out, it's going to revert back to search mode. And so there's going to be a steady tone, and usually you'll see a nice green light there. And nothing will happen until you either push this button down again, you reset the continuous treatment mode, or you turn the Dolphin Neurostim off. So those are your 3 options there. All right, flip into the back of the Dolphin Neurostim, you will see there is a circular, oval-shaped metal plate right here. When you are doing treatments, you must be in contact with this plate. So your thumb must touch this plate. If you turn your Dolphin Neurostim on and push the button down like this and try to put it down on somebody and you're not touching that metal plate, you are doing nothing more than acupressure. You're not getting any benefit from the machine whatsoever. The current has to circulate back into this device through your thumb. And if you don't do that, you're not doing a treatment. So we have people who call to us and complain that they were getting intermittent outcomes with their device. It's because they weren't actually touching the metal plate. So that's a very important thing if you're actually going to get outcomes. Okay. Up from here, you will notice there are 2 little slider switches. One of them says dry, normal, and wet. So this little slider switch will adjust the sensitivity of the ohm meter on this device. So if you are trying to find acupuncture points, motor points, or trigger points on somebody, you want to see what their skin is like. If they have really dry skin, put it on the dry setting, which is the most sensitive of the settings. If they have really wet skin is basically has salt water on it. If your skin is sweaty, and that's very conductive to electricity. So that's going to make you get false positives unless you have it on the wet setting. So this device actually finds motor points, acupuncture points, and trigger points by measuring how conductive your skin is to electricity. And it does that with an ohm meter inside the device. So if you went to Home Depot and grabbed an off-the-shelf ohm meter, you could test different points around your body, and you could see how conductive those points are. And what you're going to find is, by and large, the skin is not a very good conductor of electricity, but there are some areas of the skin that conduct electricity better than others. And all those points are acupuncture points, motor points, or trigger points, which are all lumped together in the same little ball. So if you have that ohm meter, you could go around and find these points on your body. Well, this has an ohm meter in it too, but it doesn't have a dial that you look at because that's really inconvenient when you're trying to do treatments. It's tied into a tone and it's tied into a light. So when you find a point, what's going to happen is you're going to get a really high pitch on this device, and the light's going to go off when you're on the point. So we'll go over that feature again in a few minutes when I'm showing you guys how to find points. But for right now, we need to talk about this polarity feature right here. So in the world of what we're doing, there are two ways to look at this feature. You'll see that there are three settings on it: minus, plus, and plus minus. This is direct current electricity because your body runs on direct current. So a standard TENS unit that you might get from your doctor's office or Amazon or whatever is alternating current, which doesn't work particularly well for the body for what we're trying to do. And so if you're trying to neuromodulate the body, you actually need direct current, which is what your body runs on. So with direct current, you can choose to have a positive polarity, which is the plus symbol on here. You can choose to have a negative polarity, which is the negative symbol on here, or you can choose to use biphasic current on here. So we have different uses for each of those. If you put this on the negative setting, that's what we're going to use to bring things down. In the world of acupuncture, because this device is based partially on acupuncture principles, so there's Western medicine and science involved in this, as well as some acupuncture principles. So in the world of acupuncture, you're either trying to bring things up or down. It just depends on what's going on. Anything that's a condition of excess, you want to bring down, so you would use a negative polarity. Anything that is deficient, that doesn't have enough energy, you want to bring that up. So you would use a positive polarity of the Dolphin Neurostim. So let's talk about some examples of things you'd want to bring down. And that's got to be like 95% of everything you do. Do you have muscles that are too tight? You want to bring that down. Do you have a headache? You want to bring that down. Asthma attack? Bring it down. Seizure? Bring it down. Heart attack? Bring it down. COVID? Bring it down. Gallbladder attacks, shingles, the list goes on and on and on. Pain, tight muscles, nerve entrapment, all those are things you generally want to bring down. They're conditions of excess. However, there are some things you might want to bring up. So some things you might want to bring up would be a patient who has something like Bell's palsy in their face. And so in my world, I've been using this device for probably about 25 years. I've used it in neurology and neurosurgery settings. I've used it in women's health and in spine and pain management rehab type situations. And so in all those, most of what I do is using the negative polarity. But every once in a while, you'll get somebody with something like Bell's palsy where their face actually droops and they need energy in the area. Or you get somebody who has a really, really weak shoulder that needs to be tonified to bring it up a little bit. Also in the world of acupuncture, you might have somebody who is just kind of adrenally depressed, and their adrenals are just kind of shot out because they've been on high alert for so long. So that's your kidney energy in acupuncture. So you probably want to bring that up in those patients. So there are times when you're going to want to use that positive polarity, but that's not going to be most of the cases. And this biphasic channel on here, the plus minus symbol on here, you're going to end up using that when you treat scars. You're going to use it as a kind of a last resort when other things don't seem to be working quite as well. That's a polarity you might try. Okay, so that's all the features of the Dolphin Neurostim. Now we need to talk about, oh, wait a minute, one more thing. When you look at the books that come with the Dolphin Neurostim, let's see if I can find one here for you guys to look at. Now I'm just going to grab a book here. It's not going to be the books that you guys have, but that's okay. Your Dolphin Neurostim does actually come with a it does actually come with a manual. All right, so here's a protocol, and you'll notice that next to each of the points, so there's a point right there. You can see the point right there, and there's going to be 2 letters, and there are going to be some numbers, and then there's a symbol. Okay, so this is GB34. GB stands for gallbladder. That's the meridians in acupuncture. In acupuncture, there are 12 paired meridians. Half are male, half are female. The male meridians are the yang symbol, which is the white side of this thing right here. Yang is the male side. That's your sympathetic nervous system. Those points are on the hard parts of your body. So the back, the outsides of your arms, outsides of your legs. The female meridians, which is the yin sign on here, that's the parasympathetic nervous system, or your rest and digest functions. Those are on the soft parts of your body. So that's the front of your body, insides of your arms, and insides of your legs. All those points are on meridians. So if you look closely at here, you will see a series of lines. Each of those meridians is named after an organ system in the body: lung, pericardium, heart, liver, spleen, kidneys, small intestine, large intestine. Half are male, half are female. The ones that are female are the ones that are vital for life. That's going to be like your heart, your lungs, your liver, your kidneys, the things that if you damage them or take them out right now, you are probably dead. The male organs, on the other hand, are quite a bit less important. In the words of one acupuncture book that I read, the male organs are like a man. They are hollow, superficial. They tend to fill up and empty, and you can live without them. So there you go. You could pull your large intestines out. Yeah, you're probably okay. Pull your bladder out. You're fine. Who needs a stomach, right? So anyway, that's where the male meridians move into. So if you're trying to heal or nurture your body, you're going to use the female points. If you're trying to get things done, if you're trying to release a frozen shoulder, release a psoas muscle, release tight muscles somewhere, generally those are going to be male points. So that's kind of how it breaks down. All right. So each of the meridians has some letters by it. Like that one we just looked at was gallbladder 34, GB34. So each of the points is numbered. Now in Chinese, each of these points has a name. It could be the Sea of Tranquility or the Meeting of Three Rivers or something like that. But we just number the points along each meridian. So that's what that stands for. So if you look in your books, there'll be a further explanation about that. All right. So the other part of this is that when we look at these protocols, you will see that there's a symbol at the end of each of them. So every one of our protocols is going to have a plus or a minus next to it. So when you look in your books and you look up a protocol for headaches or whatever it might be, you are going to go looking for those particular points. And here's one of the books that comes with your device. Like here's a muscle strain book. You'll see that each of them has a symbol by it. So it's going to tell you whether you put your Dolphin Neurostim on a minus or a plus. So there's always going to be some instructions there for you guys. The good news is this: if you happen to get this polarity wrong, the worst thing that's generally going to happen is generally nothing. Every once in a while, it may aggravate. Like if somebody has a headache, you could treat the points and might aggravate their headache a little bit. If that's the case, you simply switch the polarity and treat the points over again, and the headache will go away. So there are going to be times when you have the right point, but you've chosen the wrong polarity. As a general rule of thumb, if you treat the correct points, your patient's going to get better. But if you choose the right polarity, they're going to get more better. So it's rare to see any kind of bad reactions out of treating acupuncture points. Your body either takes the energy. Oh, I see a cat of another color that just passed by there. That one's orange cat syndrome. Okay. So we're going to find a couple of points here so I can show you guys how this point finder works. So I have picked out a muscle strain upper arm, and we're going to look at these points right down here. We're going to look at this point right here, which is LI4. That's large intestine 4, and you can see it has a negative symbol by it. We're going to look at this one over here too, which is large intestine 11. And the best advice I can give you guys on finding acupuncture points is when you're looking for these points, This device will help you find the points. But the other thing to remember is acupuncture points tend to be in dips and hollows. So anywhere you have a little dip or hollow on your body, there's probably an acupuncture point close to there. That's just, they're located up against bones, up against the ends of joints, and in dips and hollows. That's where you're going to find these points. So that'll be a little bit of a guide for you guys when you're looking for them. All right. So we're going to start with this one, large intestine 4. Large intestine 4 is known as Hoku in acupuncture. It is the great eliminator. It is a male point, large intestine, hollow superficial. It fills up and empties. And it is a point that is used. So Hoku, let me show you how to find it. Let's see here. Let's have a marker right here. It is right. It's not in the skin right here. A lot of people mess that up. You have to come up into the belly of the flesh right here. So if you take and make a pincer with your index finger and your thumb and you pinch right up in here, it's going to be quite tender. So I'm going to put a mark right there so you guys can watch me find this point as I look for it. Large intestine 4 is known as a great eliminator. It is also a distal acupuncture point that treats a proximal area of the body. So large intestine 4 is a point that actually treats the anterior neck and face. So if you treat this, let's change this a little bit right here. If you treat this point, it's good for anything in here. So that could be a tension headache. That could be laryngitis. It could be a sinus problem. It could be a toothache. Any one of those, like, it's fine. It doesn't really matter what the problem is. It's an area specific point. But because this point is called the great eliminator, it's widely used for pain around the body. You would actually want to avoid this point if you were treating somebody who was pregnant. First of all, I would get the doctor's advice first. I did work in women's health for a number of years, 1 day a week, and they didn't mind me using this on the pregnant patients. They would order it, but I'd always check with them first before we did this in case they had some kind of complication. So you don't want to treat the great eliminator point on somebody who's pregnant because you're not trying to eliminate the pregnancy. Okay, so large intestine 4, between the index finger and the thumb, if you pinch right here, it's going to be quite tender. And if you put your thumb and index finger together and kind of pinch them like this, you can see it makes a little mountain right here, and you can see that my point is right there at the top of the mountain. Okay. So I'm going to turn my Dolphin Neurostim on. As I told you before, we always check to make sure we get a nice bright green light there, and we do. I'm going to put my thumb on this metal plate. My skin is in pretty normal shape today. It's not really hot. It's a little chilly here, but I think the normal setting will probably work quite well. And I'm going to put this on the negative polarity when I treat the point. And I'm going to take this and I'm going to put my thumb here. I'm going to allow the Dolphin Neurostim to rest right here, okay? So the thing you want to be able to do with this is have fine motor control. Acupuncture points tend to be quite small. And if you move really quickly, like if you start just kind of poking around with this, you're not going to find your points. You need to be able to put this down on the skin and move it in small concentric circles and relatively slowly. If you move it too fast, you'll skip right over these points. You don't want to use a lot of pressure, but put a little bit of pressure on there. So I'm going to flip this. I'm going to hold this the wrong way so you can watch this device as I find the point. So device is on. I'm touching the metal plate, even though I'm holding it backwards. I'm going to pull this across my skin. Oh, let's see here. And you can hear, as I get close to the point, you can hear the pitch of the device change. And you can see that there, the light goes off and the pitch goes up. And if I move off, you can see the light comes back on. And when I get on the point, the light goes out again. So when you're on the point, you're looking for two things. You're looking for the light to go off and you're looking for the pitch to go up. And I can tell you after using this device for years and years and years, and helping do some of the development stuff on it, the most important of those two features is the sound. Okay, it's very satisfying to see the light go out, but sometimes your skin might be really, really dry and you might never get the light to go out. So what you're looking for is a really, really high pitch. If you get a really high pitch, you're on an area of high conductivity. And as long as you're on that point, you're close enough to the acupuncture point to make something positive happen. So again, turn the Dolphin Neurostim on, pull it across the skin, small circles, listen to the pitch. There, light goes out, pitch goes up. So now I found my acupuncture point. So once I found it, and you'll notice, you can see that, well, let's see if I can demonstrate. All right. So here I'm on the point. If I take my fingers off this metal plate, watch what happens. See that green light come on? That means I have no connection at all. So as long as I'm touching it and I'm on the point, the light should go out. So if you're ever doing a treatment and you happen to hear the pitch return to normal, check and make sure you're touching this little metal plate. It's a big mistake that people make. Okay. So once you find your point, you're going to push this black button and you're going to hold it down and you're going to count the beeps. You're going to count out about 30 beeps per point in each protocol. You should treat the points on both sides of the body because most of you guys aren't acupuncturists. So if you try to treat the points twice, you double your chance of hitting them once. There's a little bit of practicality in there. So you'll notice that as I hold this down, the light is blinking. But if I adjust the intensity of the stimulation, when I push that button again, let's see here. You'll notice that even though you hear this beeping, the light isn't blinking. So there are two times when you'll want to look at the light on the Dolphin Neurostim. That's when you first turn it on, and then you're looking for light. And then when you're looking for points, you're looking for the light to go off. But once you initiate a treatment, sometimes the light will flash and sometimes it won't. And sometimes when you're using two Dolphin Neurostims, the lights will start flashing together, and then they'll go out of sync and back into sync. None of that is important, okay? The only thing that is important is that the light goes on when you turn it on and the light goes out when you find a point. Other than that, don't pay attention to the lights. It will just confuse you, okay? There's nothing important there other than making sure you got a good battery and making sure you found your points. Sometimes it'll flash, sometimes it won't. It depends on the polarity, how conductive your skin is, a number of different factors. So don't get wound up in that because it just creates a lot of hassle and problems for you guys where there's really nothing to it. Okay. So we found our point. We've treated it for 30 beeps. And now we're going to move on to our next acupuncture point. So our next acupuncture point is large intestine 11, and you will see that it is at the end of the elbow crease right here. Large intestine 11 is a homeostatic acupuncture point. I used to use it a lot when my kids were little. It's a really good point for fevers and anytime you need to sort of bring homeostasis to the body. So we find this point by going to the end of the elbow crease. So we're going to go right out here to the end of the elbow crease. So let's put a little mark there so you guys can watch. Here's my little mark right there at the end of the elbow crease. Take my Dolphin Neurostim, turn it on. Make sure it's set on the normal skin setting. Make sure it's set on the negative polarity because that's what it says in the book. And I'm going to pull this across here, across this crease until I get out to the end. And you can see that once I get out there, the light goes out. So then I will push the button and count beeps. I don't care if it flashes. I'm just counting beeps. So I'm counting out about 30 beeps. Once that's over, I move on to the next point. So the protocols you're going to find in these books are time tested. We've gone over these protocols years and years and years and revised them over and over again. They are designed to be done in professional settings in about 15 minutes or so. Now, should you strive to do these in 15 minutes? Well, not unless you're a professional. If you're a professional working in a hospital setting or a clinic setting, you're going to be doing things in 15-minute increments. Most insurance companies will allow you 4 CPT codes per treatment, and you need to be able to do other things. So our protocols are set up so if you are a practiced therapist, you should be able to get most of these done in about 15 minutes. But if you are not a practiced therapist and it takes you an hour to do these protocols, that's fine. The longer you spend on these points, the more benefit you're going to get out of them. But probably the minimum you want to do is about 30 beeps per point within the protocol. So if you find that when you're doing the treatment, it's too much, then simply roll back this little switch right here and this will turn down the intensity a bit. And if you find that, you barely feel it at all, you can actually turn it up a little bit, and that's fine too. But you don't want it to be so uncomfortable that either A, your patient doesn't come back for another treatment, or B, it hurt you so much you don't want to do another treatment to yourself. So always adjust it to your comfort. That's a really important thing. Okay, so that's how to find points with the Dolphin Neurostim. And now we need to move on to talking about how to treat scars. So in my practice, I treat an awful lot of scars. I have treated, let's see, open heart surgery scars, throat surgery scars, brain surgery scars, neck and back surgery scars, C-sections, hysterectomies, mastectomies, episiotomies, knee replacements, shoulder replacements, hip replacements, like you name it with scars, I've probably treated it somewhere along the line. And the thing about scars is that your body does lay down scar tissue. No matter how good the surgeon is, your body will still lay down some scar tissue. And sometimes, even if it's a great looking scar that doesn't hurt at all, it will still bind in the area and can cause range of motion issues. So that brings me to talking about why it is we actually want to treat a scar. So why do we want to treat a scar? Well, the first reason you probably want to treat a scar is that it's painful. So nerves run from deep to the surface. They tend to get bound up in the scar tissue, which kind of tightens down around them, and they become very, very sensitive. But if you can release that scar tissue, the pain goes away. So that would probably be the number one reason. Number two reason most people want to treat scars is they can be really ugly. So you can do aesthetic treatments with this device. It will flatten out scars. If a scar is dipped in, it will bring it up. If it's raised up, it will bring it down. It'll also level out the color of them. That's something I've seen pretty regularly with this. Other reasons you might want to treat a scar, if you have something like a total knee replacement, sometimes people get a lot of swelling down in their calf because the lymphatic fluid can't get past the scarring here. It's tightened down so much. So if you release that scar, the lymph can move up through the body and get dumped back in up here. This is where lymph goes back in on the right-hand side. So it's got to travel all the way up and get dumped right back in here into your body. In the world of acupuncture, any scar that cuts through a meridian, and you can see that there are meridians everywhere on the body, is considered to block the flow of energy. So if you have had like a C-section or hysterectomy, it cuts through almost all of your female meridians, which is your ascending energy, which is very, very important. So people tend to have odd health problems after you cut through these meridians unless you restore the flow of energy through them. Also, scars can pull and create range of motion issues. So you can have a knee replacement surgery and have a great surgeon and a great physical therapist and get through all the therapy and still be a few degrees of range of motion at the end that you just can't get back. And usually that's due to scar tissue. There's not much the surgeon can do about it unless he goes back in. And if he does surgery to remove scar tissue, you'll probably get more scar tissue. But if you use microcurrent, you can change the density of that scar tissue and get your range of motion back to where it should be. Also, not only can scars affect range of motion locally, but they can affect range of motion from a distance. So you could have like a hip replacement scar and not be able to move your shoulder because your body has this stocking, what we call body stocking of connective tissue called fascia. And if you pull it down in any one area, like say you have a hip replacement scar here, it will actually pull on your shoulder. So imagine somebody pull down on the side of your shirt like this and you can't raise your shoulder. It's not because I have a shoulder problem. It's because it's being pulled down here. And as soon as you release that, you get your range of motion back. Scars can also electrically affect your sympathetic nervous system. And if you repolarize the tissue, it will return to normal and stop doing that. So how do we actually release a scar? Well, first you need to know what little we know about scars. And there's actually not a lot that we know about what goes on in scars. It's actually kind of shrouded in mystery. But what we do know is if you use the Dolphin Neurostims to treat scars, we've looked at active diagnostic ultrasounds, and we can actually see the density of the scars change. So on average, if you use the Dolphin Neurostims properly to do a scar release, you'll get about a 24% release, 24% decrease in the overall density of the scar per treatment. And whatever change you get during that treatment, that sticks. So you could do 5 treatments in a row and basically 100% release most scars. You could do them over the course of 2 weeks, or you could do those same 5 treatments over the course of 5 months and get the same outcome. So whatever change you get once you treat a scar, that sticks. And so when we treat these scars, it changes the density of them. When you change the density of the scar, they become more pliable and your range of motion gets better. So what they believe is going on, to the best of our knowledge, and what the science seems to point to, is that scars have a different polarity than the surrounding tissue. Your skin is normally negatively charged. Scars, for whatever reason, are positively charged and very non-conductive to electricity. So if you try to use a standard TENS unit with some pads like this, and you stuck like a pad over a scar and tried to run current through it that way, the electrical current would just go around the scar, because electricity takes the path of least resistance. It's not going to do much to release a scar. So you need to use point stimulators, and you need to use 2 separate sources of electricity. Okay. So those sources of electricity, we're going to change the polarity on these for treating scars. That's how we're going to go about doing it. So we need 2 different electrical polarities to release this scar. All right. So since I don't have any big major scars, we are going to pretend like we have a patient who has an open heart surgery scar, and I'm going to do a little drawing on the board here and show you. So I have treated quite a few open heart surgery scars. The scar tends to be here, and it can be quite painful. But I'll tell you where a patient's really hurt. They tend to hurt back here. So they tend to get just tremendous amount of pain in the upper back and neck because it's pulling so hard from in here. So until you release this scar, this pain doesn't go away. But the first time you treat that open heart surgery scar, they will have a significant amount of relief back in here. And that's going to be the case with most scars. So what I find is the first time I treat a patient, I expect that I should get about a 50% reduction in the overall amount of pain that a scar is causing. If I don't get 50%, I'm probably doing something wrong, because usually I get a lot better than that. Okay, so let's take a look at our board over here. So I can get you guys lined up with it here. And we are going to make ourselves a very unhappy patient here who has had open heart surgery. I'm not the world's greatest artist, but you get the picture. So here's our patient. Here is his very angry open heart surgery scar right here. And we need to release this scar. So how do we release a scar? So there are 2 settings you're going to want to put your Dolphin Neurostims on. You're going to put one of them. So this skin type little slider switch, this doesn't matter, because we're actually not trying to find acupuncture points, motor points, or trigger points. We're treating around a scar, which is mostly non-conductive tissue. So we've got to force electrons through that area. So the bottom switch doesn't matter. The top one matters, though. So you're going to want to put one of these on the negative polarity, the minus symbol, and the other one you're going to want to put on the biphasic channel all the way at the other side. It doesn't matter which hand you hold these in. Like, it's all fine. So on one side of the scar, we're going to be using our negative polarity. On the other side of our scar, we're going to be using our biphasic channel. And we are going to systematically work through this scar. What we're trying to do is play a game of ping pong here with electrons. It's not complicated. If you just follow this very, very simple formula I'm going to give you, you're almost always going to get great scar releases. Like, this works really, really well. I do teach a whole 2-day course on advanced points for releasing scars and everything like that. But that entire workshop is based on this very simple release right here. So if you learn this, just this little bit I'm going to teach you right here is very, very effective. I can tell you from having been a manual therapist, I've been a manual therapist for about 30 years. I got into this modality about 5 years into my career. And I've taken all kinds of manual therapy classes, scraping techniques, and release myofascial release techniques. I've seen people do injection techniques on scars and all kind of stuff. This is the most effective modality I've ever seen for releasing scars. It's so incredibly fast. You can do this with your hands or with a gua sha tool or with a number of other things, but it's going to take you a lot longer. We're trying to be as efficient as we can because with our patients, they only get so many visits approved by their insurance company. And if they're paying for it out of the pocket, it costs them money. So you want to give them the best outcome you can as quickly as possible. Okay, so we take our 2 Dolphin Neurostims. We have one on a negative polarity and one on a biphasic polarity. We're going to set our Dolphin Neurostims not on the scar, but on either side of the scar. We're going to go on either side of the scar. We're going to hold down that black button for about 10 beeps. You're going to count out 10 beeps. Then you're going to move down 1/4 of an inch, and you're going to do that all the way down this scar. So you're just going to keep doing this same thing over and over again until you get to the end of the scar. If it's a little bitty scar, it's going to go really fast. If it's a really long scar, it's going to be slower. I've got a guy coming in a couple of days who's got scars up and down both legs where they stripped out veins. He's got all kind of tummy surgeries. It's going to be probably an hour or more of treatment just to get those scars released a little bit. All right, so we've counted 10 beeps all the way down. And so we're playing ping pong with electrons back and forth across this tissue. You're literally bouncing electrons back and forth through this tissue to repolarize it. We're trying to change the polarity of this tissue here. And if we can successfully do that, then we'll get a good scar release. So once we get to the end of the scar, I typically switch the Dolphin Neurostims in my hand from one to the other, or you could change the polarities with your thumbs. And I work my way all the way back up. 10 beeps, 10 beeps, 10 beeps, 10 beeps, and all the way back up like that, okay, until I get to the top. And then when I get to the top, I'm going to come all the way back down again, okay, 10, 10, 10, 10, 10, 10, 10, 10. And again, we're just bouncing current back and forth through there. So what we have here is 3 passes times 10 beats. And that's your formula. It's very, very simple. Now, if you read the literature that comes with your scar release kit, it's going to tell you to plug the ends of the scar, okay? It's going to tell you to take a Dolphin Neurostim and put it at either end of the scar like that and just hold it there. So I'm going to give you an advanced tip here. Like, that's not bad, but there's something that's better that's really going to help you guys out. So if you start at either end of the scar and count 10 beeps and then work your way through the actual scar tissue itself, 1, 2, 3 passes. So again, 3 passes times 10 beeps, but that's on the scar with this one, okay? This one's beside the scar, this one's on the scar. So we start out playing ping pong with electrons back and forth through the scar. But once we get this tissue conductive, then we're trying to drive current straight through the scar itself. And if you follow that simple little formula, you're going to get really, really nice scar releases for not a lot of effort. It's a really, really nice thing. And by the way, like most of those other techniques, especially the injection techniques and scraping, don't work really well for abdominal scarring. So if you have one abdominal surgery, you have an 80 to 85% chance of getting abdominal adhesions. So I don't care if they suck your gallbladder out through a straw or they fillet you open to do exploratory surgery. Both of those have an 80 to 85% chance of getting abdominal adhesions. So that's scar tissue that goes beyond the boundaries of the scar. It'll wrap around your organs. It'll connect things. It'll connect muscles together. Causes a lot of havoc. If you have 2 abdominal surgeries, it's 100% chance you're getting abdominal adhesions. So if you've had C-sections or gallbladder surgeries or whatever, abdominally, you need to do an abdominal treatment. If you can't see, obviously, where, let's say you had laparoscopic surgery, if you can't see where the probes went in there, you're just going to have to pretend like you see the scar. So I would just treat lines across your patient. I would do like 3 lines across and 3 lines up and down, and you're going to pick up most of the scar tissue in there. And you can release scar tissue really, really deep in here, like really, really deep stuff that otherwise is very difficult to get to. So that's basic scar release. But what if you had a situation where you were treating somebody who had like a steam burn, or they dumped a pot of boiling water on their stomach. What if you have a scar that looks like this? Like, that's not a linear scar. What do we do for that scar? Well, for a scar like that, you're going to do it almost the same way you did above here. You're going to stay on the outside borders of the scar this time, except you're just going to work around the scar like it was a clock. So again, 10 beeps at each one of these points, and moving about a quarter of an inch, and 3 passes all the way around. The difference is when you get to this part of it, you're going to have a lot of surface area in here that you have to cover. So you have to go through here, through all of this, cover all that area in there. And it's just going to be time consuming to do all that, but you can certainly do it. I've treated a lot of burn scars. We have a lot of plants and mills down here in South Georgia where I live. They use a lot of steam, and I've seen some really nasty steam burns from that stuff. So that's the basics of releasing scars. Practice that. I promise you guys are going to get nice outcomes. All right. So next thing on the list we need to talk about. We need to talk about the vagus nerve. So what is the vagus nerve, and why on earth would you want to do vagus nerve stimulation? Well, the vagus nerve is the longest nerve in the body. It runs from your brain, but the closest you're going to get to it is by the ears. Comes from here, comes together right down in here, and runs from here all the way down into your gut. It's also known as the wandering nerve. It's the information superhighway between your brain and your gut. More information actually goes from your gut to your brain than your brain to your gut. So the vagus nerve is often known as the second brain because it has a very strong influence over the sympathetic and parasympathetic nervous system. So that's your autonomic nervous system. That's your fight or flight response and your rest and digest functions. So if you do vagus nerve stimulation properly, you can use it as a neuromodulator to shift your heart rate variability. If you don't know what heart rate variability is, look up HRV, heart rate variability. It's a measure of total power of your autonomic nervous system. It's pulled from an EKG. Aura rings measure it. Sleep number beds will measure it sometimes. Apple Watches will measure it for you. You can look up tons of studies on it. So there's just Google it and look up how important it is. Your heart rate variability is at its highest when you're about age 8, and it decreases over time. So the higher your heart rate variability is, the healthier you are. The lower your heart rate variability is, the more likely you are to die. So basically at age 8, your heart rate variability is at its highest up here. Your cortisol, which is your stress hormone, is at its lowest down here. And then as we age, what happens is that your heart rate variability naturally drops and the stress of your life increases. So your cortisol goes up. So at some point, they kind of cross, and then your cortisol is higher and your heart rate variability is lower. And at some point, your cortisol gets too high and your heart rate variability gets too low, and then you die. So heart rate variability is one of the few markers that's actually tied to longevity. So the higher that number is, the better your survivability is. There was a study that came out. Actually, it was just a couple of years ago, and they noted that people who have high heart rate variability have a 66 greater % chance of surviving cancer. Let me say that again. You can have 2 people with the same cancer. The one who has high heart rate variability has a 66% greater chance of surviving that cancer than the person who has low heart rate variability. So being able to manipulate this number and kind of hedge your nervous system to make it more robust and more resilient is a really, really good thing. We actually have used this quite a bit during COVID. We had a medical indication in Canada through Health Canada, which is that's like the FDA up there. These devices were actually approved for acute respiratory distress with COVID and for long haul COVID. Now, we're past COVID and they don't have that indication anymore, but it was quite effective. It worked very, very well. I used it on myself when I had active COVID. I was able to take my oxygen saturation from a very dismal 80% up to about 91% in about 2 hours of vagus nerve stimulation. And had I not done that, I probably would have ended up in the hospital. I was so sick. So it is a very, very useful tool. So why would you want to do vagus nerve stimulation? Well, if you have any kind of inflammation in your body, if you bring your heart rate variability up, systemic inflammation goes down. So heart variability going up stops the production of pro-inflammatory cytokines. So if you have an autoimmune disorder of some kind, you're not going to cure your autoimmune disorder with vagus nerve stimulation, but you can keep yourself from having flare-ups of it. What sets off IBS? What sets off uh, multiple sclerosis? What makes cancer worse? What makes heart problems worse? What makes, like, fill in the blank? What makes allergies worse? Stress. Stress makes all those worse. The more stress you add, the worse you're going to do. So if you can increase your heart rate variability, your body deals with stress much better. And stress can take a number of forms. It doesn't matter what form it takes. If you can program your body to be more robust in its response to the stress and more resilient in its healing response, then it puts you on the right path. So, how do we do vagus nerve stimulation? Well, if you're going to do vagus nerve stimulation, you got to be able to get to the right points around the ear. So, you're going to need some of the things that come with your vagus nerve stimulation kit. You're going to need these ear clips that look like this. So let's go ahead and put together a vagus nerve stimulation demonstration for you guys. So got a Dolphin Neurostim right here. I am going to need the following things out of my vagus nerve stimulation kit. I'm going to need this cable that has a male connector on one end and a little cup that has a little, like, metallic disc in it on the other end. I want this to go on here. So I want that little metal plate to touch this little metal tip right here. So if I push this on here, if I turn the Dolphin Neurostim on, you will see that the light is on. But if I touch this metal plate, I'm completing the circuit, and you can see that light goes out. So that tells me I've got a good connection there. So this is one of the pieces you'll need. You're going to need some of the oval electrodes that come with your kit. They look like this. I strongly recommend that you clean this with an alcohol wipe before you put these on here. These oval electrodes will never touch your skin. They're always going to be on the Dolphin Neurostim. If there's any oil on this metal plate from your skin, it will keep them from connecting very well, and they're not going to stick very well at all either. So if this is nice and clean, then these will always stick well. You can use these over and over again for months. And of the electrodes you got, these are the most expensive ones because we have to have these custom cut to fit the Dolphin Neurostim. So we're going to put one of those on there like this. So you've got that. And there is a white cable that comes in the bag, comes in your bag of electrodes. There's a white cable that looks like this. It has what looks like a male connector on one end and a female on the other. But if you look in there, you will see that this is a shrouded male connector. So both ends of these are exactly the same. Don't be fooled. It doesn't matter which end you use. You'll notice that this has a white tail on it, and this is a white cable. So I'm going to connect the colors together. So I've got that connected, and you'll notice this has a black tail. Well, the ear clips have a black tail on it. So there are two types of ear clips in your kit. There are some black ones that have a little metal plate on them, and there are some white ones that have like a little dome on them like this. Of the two of them, these are my favorite. They both work pretty well, but this is, I think, the best one for most situations for doing vagus nerve stimulation, and I will show you why. We actually had to have these. We had to develop these for vagus nerve stimulation. So if we take a look at the ear where you're trying to put these things, there was a study that came out towards the end of last year, and it was an MRI study, and they looked at the most the most nerve endings that had to do with the vagus nerve that were close to the ear. And they were in two locations. So the highest concentration of nerve was on the inside of the tragus. That's this flappy thing right here. So if you push this little flappy thing and close your ear hole, it's on the inside of that. So right inside here, on the inside surface of this, was one of the areas. And the other area was in the upper concha of the ear, which is right here. And that area is particularly interesting to us because it is much easier to get an ear clip on there. So let me demonstrate. If I take one of these ear clips, it doesn't matter which one we take, and I try to put this on the tragus like this. You'll see that it slips off very easily. But we've designed these to have this dome on them, so this is conductive rubber. And this fits very nicely. It's made to fit up in there and get contact with the inner part of the ear right there. And you've got a nice solid lockup right there. So that's what you're looking for. Now, whichever ear clip you use, whether you use the white ones or the black ones, you need to put something conductive on it. So you could use an alcohol wipe. You could use a little bit of water. I use something called 1020, which is an EEG paste. It's kind of sticky. So I take just a tiny little dab of this and I put it on here. And then I just put it on my ear. And I get a better, it conducts better. Excuse me. So my recommendation is you get something conductive to put on these. That EEG paste, you can get it on Amazon. They do not have it on the Dolphin Neurostim site. For goodness sakes, don't call them and ask them for it because then they'll fuss at me. So go to Amazon, pay $20, get yourself a little tub of that. It'll last you for 5 or 6 years. Okay, so the black tail on this connects with the black cord that comes off the Dolphin Neurostim. And now I have a white cable and a black cable. The only thing I'm missing now is one of these rectangular electrodes like this. Again, this has a white tail and fits on the white cord. So we're going to connect that up. And there is a card that comes with your Dolphin Neurostim that shows you different ways that you can actually connect the Dolphin Neurostim. So you can connect it to your ear and to your tummy like this, or you can connect it from your ear to your wrist. So let's talk about the different ways to do this. Obviously, you have 2 ears, and it's a little different from one side to the other. The left ear is much better for bringing things down. So most of the stimulation we're going to be doing for calming your system down is going to be using the left ear. And if you want to bring things up a little bit, like if your energy is a little bit low, let's say you have like, let's say Lyme disease or chronic fatigue syndrome or something like that, you may need to boost your system a little bit, and that's more of a right ear application. So if we put this on our left ear, and again, we're going to take our little dome electrode here and put it on the upper concha of the ear right in here with some conductive medium. I want to put the Dolphin Neurostim on the negative setting. Now, your choice of skin type doesn't matter because we're not trying to find acupuncture points. We got it sticking up here in your ear. So we're going to put, this doesn't matter. This you want on the negative polarity because we're trying to bring things down. For me personally, I like taking these pads and I put them on my stomach. So I put them about 4 fingers below my belly button right there, and I'm good to go. Turn the Dolphin Neurostim on, and you could hold this button down the entire time, but it makes a lot more sense just to push this little button right here, and now it's in continuous treatment mode. Now here it is blinking, but like I said before, it's not always going to blink. So that just depends on whatever. But you can go wash dishes, you can read a book, you can do whatever. The first time you do vagus nerve stimulation, you want to do a 5-minute treatment. We don't really know how your body's going to respond. The vagus nerve is very finicky from one person to the other. It doesn't follow the same track on every single person. Sometimes it comes apart a little bit, goes back together. Some people's systems are a lot more sensitive than others. So 5 minutes on your first treatment, see how you do, and the next day you can do a little bit more. We recommend adding 5 minutes a day until you get up to about 30 minutes, and that should be good for most people. If you're going to do the vagus nerve stimulator on the right ear, put it in the upper concha of the ear. You can put this on your belly button or below your belly button, and then you're going to put it on the positive setting to bring things up. Now, if I were doing the positive setting to bring things up, that's a better application for in the morning than in the evening, because if you do the right ear on positive in the evening, it has a tendency to wind your system up a little bit. What you'll find is sometimes you have difficulty getting to sleep. We've had a few cases of people who it really did keep them up for a couple of hours. So I recommend doing this first thing in the morning or noon or something like that. But if you're going to do the left ear, you could do it in the morning. But But definitely at nighttime is when you want to do a longer session with the left ear. So how long can you do this? It really depends on what's going on with you. Like when I had really acute COVID, I did vagus nerve stimulation for 2 hours straight. And that's what brought my oxygen saturation up. If I were um, an athlete of some kind and I just finished an intense workout, I would do about 20 to 30 minutes of vagus nerve stimulation and I would be done with it. So, how do I use vagus nerve stimulation? Like, how long do I do it? How often should you do it? It really depends on what's going on in your life. So, I'll give you an example. So, let's do like a profile of Joe. Let's see here. I'm 54 years old. I'm in pretty good health. I raised 2 children by myself, and I work an awful lot. Like, I start seeing patients at 8 o'clock in the morning. I work 10 hours straight through till 6 o'clock at night. And on time, and then I get home and then I'm taking care of my kids and feeding my kids and doing homework with them and doing all kinds of stuff like that. So I really don't stop much. And then on weekends, some weekends I'm off teaching somewhere or doing stuff with my kids. So I don't get a lot of downtime. So for me, at my age and with what's going on in my life, if I do vagus nerve stimulation probably twice a week, maybe 3 times a week for about 30 minutes, that's perfect. Like it recharges my system. I don't get tired in the middle of the week. It does a really good job of helping me recuperate from the stress I put myself under. Now, if I were extremely ill, like I had something like Lyme disease and it were really dragging me down, I might actually be doing hours of vagus nerve stimulation a day on my right ear on positive. I've had some patients who do that and it's really helped them out. If I had something like Parkinson's disease, I might be doing this for a longer period of time. I might be doing it several times a day. So what you're going to have to do is experiment around a little bit with this to see how it works for you. You can also try it on your wrist. You'll notice that in the information you get with the Dolphin Neurostim, there are applications for doing this on the wrist. So on each of your wrists, you have 3 acupuncture points known as the golden triangle in acupuncture. Those are parasympathetic calming points. So you do a good job of bringing things down quite a bit. And if you stimulate those points, it will really chill you out. So if you're really, really stressed out, I suggest using one of your wrists to do vagus nerve stimulation. If you're doing the left ear, use the left wrist. If you're doing the right ear, use the right wrist. There is one other piece of this equipment that you will find in your kit. It is known as a Y wire or a splitter. So it looks like this. Okay. So that's going to be in your vagus nerve stimulation kit. You're going to remove the ear clip from the black cable. You're going to connect this to this black cable. And now I have 2 male connectors here. So I'm going to put an ear clip on each one of these like this. And I can put this on the upper concha of each ear like this and like this. So I have one on either ear. If you're going to do this, I do recommend putting this down on your belly button or below your belly button, 4 fingers below your belly button or so. And when you turn the Dolphin Neurostim on, you want to slide the switch all the way over to the plus-minus setting, the biphasic setting. So that's going to bring stuff up and down through each of your ears. It's not really a 50-50 balance between the ears, but this is about as close as we can get without getting into really complex equipment. So you're going to put it on that setting, and you're going to put it on the, you're going to use your little continuous treatment mode and turn it on, run it for 5 minutes of first treatment, add 5 minutes a day. And this works well for a lot of people. A lot of people think this does a better job of balancing their system out than using one ear or the other. You'll have to see how it works for you. We have had a few cases of people when they do vagus nerve stimulation with a clip on either ear, they get a little bit nauseous. So that's you. If you try it out, you might run it for 5 minutes and see if your system gets through it. But if you don't, then I would just use either the left ear or the right ear and kind of be done with it. Everybody's system responds a little differently. So that's kind of the ins and outs of vagus nerve stimulation. If you do this treatment consistently, you can use it as a neuromodulator. You can actually shift your heart rate variability up because it reduces stress on your system. It actually programs your body to deal with stress better. And the less stress your body has, the healthier you are and the longer you live. And it is a very, very useful tool for dealing with chronic conditions. All right. So that is all of the information about the vagus nerve stimulator. There is one piece of equipment that comes in your Dolphin Neurostim kit. So let's see if I can find one here. We haven't talked about. It is this little thing right here. To use this, you are going to stick this little metal cup on the end of the Dolphin Neurostim. You'll notice that this looks like a pen and it has a tip on it, and it is bendable like this. So you can bend it into whatever shape you want and bend it back. So this is used for treating points you can't get to. And notice that I have my thumb on the metal plate right here. So I could use this to treat points in the back of my neck. I could actually take this to a back scratcher and treat down my back with it. And I could find a tender point and I could hold this down right here. And I could treat those particular trigger points right there. So you could work through an area and treat all the trigger points and tender points with this little thing. We do have some therapists who use these to treat TMJ with. They get inside the mouth and use these for the internal pterygoids. It's not what they're designed for, but that's what they use them for. And when I worked in women's health, we would actually use 2 of these to treat episiotomy scars. We'd make the patient buy 2 of these and use them for that. So they are useful. For you, like I've had some of these that have lasted me for years treating myself. So it's a nice little tool to have, especially for self-treatment. Okay, we need to talk now about contraindications for the Dolphin Neurostim. So here are the do's and don'ts. The number one thing is what I refer to as the rule of pencils. We're going to call this Joe's rule of pencils. Don't stick this thing anywhere you wouldn't stick a pencil. Don't jam it up your nose. Don't stick it in your eye. Don't stick it deep in your ear. Like keep it out of places that you don't need like deep penetration into where you can damage things. As long as you do that, you're pretty good. So plates, screws, artificial hips, artificial knees, artificial discs, rods, pins, cages, all that stuff, fine. It does not bother that stuff in the least. Don't worry about that. That's all good. Dorsal column spine stimulators, those are fine. Baclofen pumps, those are fine. Insulin pumps, those are fine. Bladder stimulators, those are fine. Here are the things that aren't fine. So if somebody has a pacemaker or a defibrillator, you need to go to or contact their cardiologist before you do this treatment. And in the little booklet that comes with the Dolphin Neurostim, in the first couple of pages, there is a little thing that has the output of the device. It looks like this. You can copy this off and send it to them and say, hey, we would like to do microcurrent therapy on your patient. These are the electrical parameters, and they're going to say yes or no. So that's your rules for that kind of thing. Pregnant women, don't treat pregnant women unless the doctor says it's okay. If it's you, you can do what you want to do. If it's you, I strongly recommend that you don't do a treatment within the first trimester. If you're going to have a miscarriage, it happens in the first trimester. Beyond that, you're pretty good. But if you're going to be treating somebody else, get the doctor to okay it first. There are some points you want to avoid. So here are the points you want to avoid if you're going to treat somebody who's pregnant. Don't treat on top of the head. That's governing vessel 20. That pushes energy down. You're trying to keep the energy in. So don't treat that. This is contraindicated even with needles, especially on patients who have epilepsy. If they have epilepsy or seizures, avoid the top of the head. There are points that stop seizures. Like there's a point on the bottom of the foot called kidney 1. It's right here. It is a rescue point. I have seen that point stop seizures. It works for that. But don't treat on top of somebody's head if they have seizures. Other places to avoid with pregnant patients. So top of the head, avoid that. Tops of the shoulders, this pushes energy down. Don't treat there. Large intestine 4 that we learned earlier. This is the great eliminator. You're not trying to eliminate a pregnancy. This is useful for bringing on labor when it's time. But before that, you want to avoid this point. Do not treat over, obviously this is a guide, but don't treat over a gravid uterus if you have somebody who's pregnant. A lot of doctors will okay TENS units to put on patients' backs, but they don't want any electrical stimulation over this area. So avoid that. Avoid the insides of the ankles. There's a point there called spleen 6 that is the most female acupuncture point. It influences the perineum, like the lower viscera, and it is a point that is used to induce labor. So avoid treating that point, and you're in a pretty good place. What else? Cancer. Okay, so there are arguments for and against using microcurrent on cancer. It is not a contraindication, but it is a caution, I think, to the FDA. So here are your arguments. This device, microcurrent itself, is a really good healing tool. It promotes healing. So if you do this over an area that is injured, it increases ATP production 400 to 500%. That's adenosine triphosphate. That's a mitochondrial fuel. It will ramp up healing significantly. It increases protein synthesis. It increases cellular membrane transport. So it does everything you need to do to stimulate healing in an area. There's a microcurrent therapy on the market, not this one. There's a microcurrent therapy on the market that is used to treat glioblastomas, which is brain tumor. They're brain tumors. They're cancerous brain tumors. And they use a microcurrent to shrink those tumors. So that one does have that medical indication. This does not. So the thought is, if you're treating an area of cancer with microcurrent, because this increases ATP production, and because this increases protein synthesis, and because this increases cellular membrane transport, you don't want to increase those in an area of uncontrolled cell growth. So there's arguments either way for this. So you'll have to do some research and kind of, see where your doctor stands on that if you're going to be doing this. I did used to use this quite a bit. There was an oncologist on the floor above me who had patients who were getting chemotherapy who would get very, very nauseous. And we did successfully use this to treat the nausea associated with chemotherapy. And that was under his orders, and it worked very well for that. Okay. So there are your kind of do's and don'ts with this. It's fine to use on children. Just turn it down. We've done workshops for All Children's Hospital down in Tampa. They use this on babies, like little bitty babies. I've treated cats. I've treated dogs. I've treated horses. Never treated a bird before. But anyway, cats, dogs, and horses, it works fine and can be quite useful. So I think that's all the do's and don'ts of this device. And what we need to do now is get into the questions that you guys have put in the comment section, so I can get those answered for you. So I'm going to go look in the chat section here and go through the questions. Let's see here. In the book, there are steps in the protocol. How do we use these steps? Okay. So in your books, if something has step 1, step 2, step 3, step 4, always follow the steps in order. But within each of the steps, there are a series of points marked. The order of the points doesn't matter. If you get a protocol like this that just says muscle strain, upper limbs and arms, you could start at the bottom or you could start at the top. It doesn't matter. This is not an ordered protocol. This is just all the points you would use to treat that disorder. So if you treat 5 of those points and the muscle strain is gone and better, like, stop there. You don't need to do all the points. As a general rule of thumb, the less points you do, the better. Like if you get a really good response from treating, say, 3 acupuncture points, stop there. Every time you treat an acupuncture point, you're giving the body a set of instructions. Turn this on, turn this off, push energy here, pull energy there, get rid of damp heat, release the psoas muscle, stimulate your brain, whatever it is. The more instructions you give, the more you muddy the waters. So you get a good response on just a few points. That's good for the day. Try the rest of the points at a different time. All right. If 24% is improved and we do 5 treatments, the scar success rate should be more than 100%. Well, I mean, you're not going to get more than 100%, but yeah, if you do 5 treatments, generally that's going to get you 100%. Sometimes it's 2 treatments. Sometimes it might take 6 or 7 treatments. It really depends on the scar. It depends on how thick the scar is. If you have a really, really long, thick scar, it's going to be very time consuming to get that entire thing released by 24%. So it might take you more treatments. you'll get there, but it's just dependent on how long the scar is and how thick the tissue is, because you have to bounce electrons through all that tissue to repolarize it. It's a game of electrons. You're bouncing electrons back and forth through there. So the better you do that, the more efficiently you do that, the better the scar is going to look and the more it's going to be released. What's the ideal frequency or interval between sessions for scar treatments? Okay. So in a pinch, if somebody flew into town to see you, you could do scar release twice a day for a week. But what we have noticed is that when we treat scars, the scars actually change for about 48, sometimes 72 hours after the treatment. So I would say it's a good idea to leave at least a day or so between treatments, because that lets the tissue kind of continue to unwind. Once you get that process started, electrically, it continues to repolarize for a while. So I would just let it go just to maximize the benefit of each treatment. So I would say, leave a day between treatments, 2. I wouldn't go much beyond that. Anything beyond that, you're not really gaining anything. How soon after surgery may you use a Dolphin, or what are the contraindications of the unit? Okay. Rule of pencils, don't stick this in an open wound. But holy smokes, if you treat around an incision, it makes all the difference in the world. So because this is a healing, because microcurrent heals, you can actually take things like non-healing diabetic ulcers on people's feet. I've had friends of mine who went to wound care at the hospital and it wasn't working. And we did this, just friends of mine treating at home, but nobody was paying me to do it. And we got tissue granulation when other modalities fail. So it works very, very well. So I actually trained a surgeon in Los Angeles. She was a general surgeon. So she was going to do surgery on you. She knew where the incisions were going to be. So she had one of her techs actually treat that area like a scar, because it actually builds up ATP in that area. It stockpiles it. So then when she did the surgery, when she stitched the patient back together, it would start healing immediately. And then in post-op, she would have that area treated again, but again, not on the incision, around the incision. Now, if you've had a knee replacement, there's going to be a huge dressing here. So you may have to go really wide to treat on either side of the dressing, but the more you bounce current back and forth between there, the faster you heal from it. So you can use this immediately after surgery, and we have therapists who do that in hospital settings. We went over the contraindications earlier. Can we find more protocols that are not in the book? We do a lot of workshops, so you can take online classes that have a lot of protocols in them. You can take some of our advanced courses for like concussion and brain injury, scar release, neck and back release, advanced circuits, auricular therapy, ear acupuncture. We teach protocols in all those. Eventually, we have a lot of protocol books that are no longer on the market, because a lot of those protocols are just very, very specific and people don't use them. So we're in the process of putting that stuff in an online format. So you can just click on the protocol, and for, I don't know, like 78 cents or whatever, you'll get your protocol for how to treat a gallbladder problem. So those will be available at some point. I don't know the timeline on that. That's not, I use this modality and I teach it to therapists. I don't really develop the online content. So I don't really know what the timeline is on that. Any protocol you find, however, that has to do with acupuncture, you can do with this, because this unit was designed by an acupuncturist to treat acupuncture points. So any acupuncture protocol you happen to have, if you just follow that, you can use this with it. All right. How can someone treat a person post gallbladder removal? Gosh, there's a whole bunch of things. You can treat the nerve roots in the back. So each vertebral segment in the spine has an energetic intervention. So gallbladder is in here somewhere. You're going to treat the shoe points, and you're also going to treat the nerve roots that go towards the gallbladder. So whichever nerve roots in here. So the shoe points are 2 fingers off the spine at each vertebral segment. So you want to treat those first, because those are the nerves that go to where the gallbladder was. You want to treat the incision if they have little tiny holes poked in them from having the surgery. You're going to treat each of those like a scar, and then you're going to treat back and forth across the area. You're also going to want to treat any meridians that go through that. You probably want to treat the end of the gallbladder meridian. There's a water point called gallbladder, what is that, gallbladder 40 something, right? Well, that's gallbladder 41. So I guess it's maybe gallbladder 43 right here, which is a water point. Water puts out fire. And since you've accosted the gallbladder, treating that water point helps quell the fire in here. You might treat spleen 6, push energy up through that area to clear the area. So there's a lot of different things you can do once you get into doing it. But the big thing is just to treat this to speed up the healing process and to minimize any adhesions they may have in their stomach. Make no mistake, when you have a scar, you will not get rid of the scar with this device. The only way you can ever get rid of a scar is to cut it out. And if you cut out a scar, you're just going to get more scar tissue. But we can change the density of scars. So when people tell you that they broke up a scar, like they may have it a little more pliable, but that scar doesn't go away. Like it's always going to be there. Does it matter the age? Oh, wait a minute. Let's see what else. How do you learn how to treat cats? You just get an acupuncture joint chart. You can buy them online. Any of the protocols we have in this book, they work on cats. Just remember their anatomy is a little different. Please do pay attention to what I'm telling you because I've treated several cats, one of being my own cat. Some of them don't like this very much, and cats are not as nice as dogs. Like they can really hurt you. So be cautious. Just turn, if it were me, I would put this device probably on the not loud version. So I would probably put it on the silent one and just kind of guess where the points are rather than having that high buzzing near their ears. They don't like that as much. But you can, like, if they have disc problems in their back, you can treat over their backs. Like my neighbor across the street, it wasn't their cat, it was their dog. They have a poodle who's like 2 years old. And the poor thing, like, I don't know, ruptured a disc or pinched a nerve in his back, and he was paralyzed. Like he was dragging his feet behind him. They gave the poor thing a steroid shot, and they have one of these devices because my neighbor across the street had a stroke a few years ago, so I gave him one of these. So I was like, hey, use this on your dog, and I showed him how to use it. Like a couple of weeks, the dog was walking fine. So anyway, it's a very useful thing. If you want to know how good you are, treat an animal. There's no placebo response. If they can't walk when you start and they can walk when you're done, you did it right. They don't expect to get better. They just want you to stop doing this. So same thing, horses, they all, horses are pretty easy because horses are used to getting bitten by flies. So this really doesn't bother them much. The noise may bother them a little bit. So you need to make sure they're used to the noise so you don't get kicked. And horses do bite sometimes. All right. If you have small scars, how do you do the 3 sweeps on it like you mentioned? Just make little teeny tiny circles. It's not you just work around it as much as you can. And if you have teeny tiny scars, you can hold this for a much longer period of time in that area because it's not like it's going to take you hours to treat it. So just keep treating, just work around that little tiny area. Does it matter the age of the scar? Actually, it does not. Generally, the older the scar is, usually the easier the treatment is. So if you have a 60-year-old scar, the oldest scar I've treated was probably, I don't know, 70 or 75 years old. I've treated some very, very old scars and gotten amazing outcomes with them. Like people who couldn't move parts of their body and treated the scar, and all of a sudden it's the best it's moved in 70 years. So it doesn't matter how old the scar is. You can always release that tissue. Let's see what else we got here. We have where to start with entire extremity burn scar. It's going to be a time-consuming treatment. So, if the whole arm is burned, I would generally start in the least sensitive area. Sometimes, like burn scars, can be very, very sensitive. A lot of times, the fat gets burned away, and the skin is very, very sensitive around those areas. So, I would treat the least sensitive areas first. So you want to desensitize it. You may actually have to work kind of out from the area. So if, let's say, the scar went from here down, I might actually start up in here and then slowly start working my way down through the tissue. If it's numb, then it's fine. But it's just going to be time consuming. You're going to have to if this whole thing was burned, you're going to have to do lines, do a line, do a line, do a line, do a line. It's going to be very time consuming. but it does work. Like, it is absolutely worthwhile to do it. You'll see people who are really, really adhesed up get much better range of. You'll see contractures actually start to get better. It's not easy, but there's not much out there for that can help. All right. Let's see here. Love the pre and post op idea. Yeah, that works well. Is it normal for your device to stop beeping when it is activated on spot? It doesn't actually stop beeping. The pitch goes so high that you just can't hear it anymore. So yes, that's a really good thing. That's from Kiera. Yes, that's perfectly normal. That's actually what you want. You want a really high pitch or almost nothing. I guess you would do the SCAR protocol on surgical post-op incisions. Absolutely. What do you do with a case where there is pain down the front of the thighs, but it stems from the muscles around the back and the kidney area? Where do you treat? Okay. So if you look back here, this is a dermatome chart. You can actually buy from the folks at the Center for Pain and Stress Research and Dolphin Neurostim. You can actually buy. They won't send you a big poster like that, but you can buy these. They're about $10, maybe 15. I don't know. But if I look down the front of the thigh, like, I can see which nerve roots are involved. So this tells me, there's L2, L3, L4, L5. So I go around to the back and I treat over those nerve roots. But at each vertebral segment, there are a series of acupuncture points known as SHU points, SHU. They are located at each vertebral segment about 2 fingers off the spine. They look like this. These are the nerves that feed the front of the thigh. So you're going to treat in here first to treat this area. That's how you start on that. And then I would also consider treating in the area where it hurts, and then also treating the jing points, which are points that are going to be near the ends of the toes, because these meridians run up through that area. All right. What about TBI people who've had it for years? I have seen some really amazing recovery from stroke stuff, even years afterwards. Some of our concussion patients, some of our post-concussive patients that we've treated, which is basically a TBI, they've had that stuff for years and years and years, and sometimes 1 or 2 treatments is enough to shift them. I've also had people I've worked on for months. I've seen some amazing things. I've seen people who could barely speak, and I've treated a couple of acupuncture points and given them their ability to speak. They had weird aphasias, and it fixed it up. Twice in my career, I've had patients who were blind in one eye from a stroke, like not a little bit blind, but completely blind, tested blind in one eye. And in both cases, I gave them their vision back in that eye. So there's nothing wrong with the eye. It's just a connection between the two. And occasionally you can reconnect the central and peripheral nervous systems. I can't guarantee you. I haven't treated enough people like that, but in the 2 I've treated, it actually worked quite well. All right, let's see what else we got here. Can't hear beeping, so going on light off and on. That's not a problem. That's perfect. Diane, if you can't hear the beeping, just watch for that light to go off and then hold the button down. You're good to go. Would you treat heart palpitations with vagus nerve sessions? Heart palpitations in high stress settings or all out effort for an 18-year-old athlete? Well, first, I would check with their physician to make sure that's okay, because I'm not a physician. I would say, hey, we want to do some vagus nerve stimulation. That's okay. If they give you the okay, vagus nerve stimulation, I think, would be a viable option for that. I would also use the parasympathetic calming points on the wrist. I think those are a good option for that because it does calm things down so well. So I think you're on the right track there. Will there be a replay sent out of the class? That's from Sherry. Yes, there will. You guys are going to get a link in your email in a few days. You can watch this over and over again. This is a free thing. So if you guys want to sign up for it again at some point, you can certainly do that. Like some days I wear like a white t-shirt instead of a black one. Sometimes I say things a little bit differently. So you can certainly sign up for it and take this again if you didn't get all of it. But you will be able to watch this over again. Would a scar release session possibly work on lipomas? Have you treated those before? I have been able to release the tissue around lipomas, but lipomas are a fatty tumor. So they tend, once you have them, they tend to kind of stay. But I have been able to eliminate the tenderness of certain lipomas. How can I implement this to lymphatic drainage treatments? Well, I would say that if you are doing lymphatic drainage, this should be the first thing you do because this makes everything else easier. Lymphatic drainage. Let's say you're doing manual lymphatic drainage for, I don't know, the leg. If there's any scars in the area, you got to treat the scars because that restricts the flow of movement of the lymph. Then you're going to want to go treat the shoe points in the back because those are the nerves that go to that area. So you want those to be released. And then you're going to treat things. You're going to do circuits. So you got to get an advanced circuits course. And you got to do things like circuits between spleen 6 and stomach 36 to pull the energy down and push it back up because chi in a lot of ways is a lot like lymph and how it moves through the body. So you can actually push and kind of pull it. So you can force the lymph back up through the areas. You need to release some muscle groups that bind down in the areas the lymph can't get around. And once you've done those things, then you go do your manual lymphatic drainage, and it's much, much easier. We've actually had several therapists who do this therapy who specialize in lymphatic drainage, and it is quite useful. And I'll just go on record as saying this. I don't really care what kind of therapist you are, PT, OT, speech language, whatever. This modality works very well with the other things you do. And it doesn't work better than what you already do. But this should be the first thing you do because it makes everything else easier. Like, why work so hard? Like, if you're a massage therapist, why work so hard to release this muscle with your hands when I can treat a point on the toe and release the psoas muscle by like 80%? Why on earth would I go digging around in somebody's stomach when I can treat a couple of acupuncture points and release it? So if I can use some acupuncture point and use some microcurrent to release things first and then do whatever I do afterwards, it just makes it easier. You can do vagus nerve stimulation while you're doing manual therapy. You can do it while you are stretching a patient. There's a lot of applications for doing this at the same time you're doing other things. I unfortunately came in very late to this tutorial. You have access to this recording, so I can go back and watch it. Yes, then you can watch it again. You're going to get a link. And you can take this over again if you want. Can you treat scar tissue in the pelvic and groin area? Yes, I have treated episiotomy scars and all kinds of things. I had a guy one time who had necrotizing fasciitis. They did 70-something surgeries on this guy to dig out like dead tissue. And he was scarred from here all the way under his scrotum, all the way up the other side. 70-something surgeries. He was really bad. And we had to treat all that. And it was the only way to get it all released. And he was in a tremendous amount of pain before we started. He's lucky to have lived through it. What about a scar from thyroid removal? It's safe to treat. Absolutely. You could even do things like treat from the front to the back like this with your Dolphin Neurostims and treat that deep tissue in there. Or you can treat on the little thyroid scar right here, back and forth. That's fine. Oh, don't push on the carotid artery with this. It's fine to treat the front of the neck and sides of the neck, but the carotid artery, it's not the electricity, it's the manual pressure. So if you massage the carotid artery, you can actually make somebody pass out. So we want to avoid doing that because we don't like it when people pass out because that involves ambulances and nurses and doctors and things that you don't want in your life. So don't push really hard on the carotid artery with this, but other than that, you're fine. You can treat the front of the neck. You can treat the sides of the neck. That's all good. Make sure you don't have any history of blood clots in your neck, obviously, before you go poking around in there. All right. Let's see what we got here. Do I stop scar release treatment if the size of the lipomas gets bigger after a session? I've never seen that happen before. It may be, I don't think the lipoma has gotten bigger. I think what you've done is you've released the tissue around the lipoma that was tight, and now it's actually spread out a little bit. But you're not going to actually make the lipoma grow any by treating it with microcurrent. It doesn't work that way. Lipomas actually tend to be genetic, so they tend to be passed down. It's just a question of whether or not they're in an area that bothers you. Can guys use the scar release on circumcision scars? Yes, they can. You can also use it on Peyronie's. It works very well for that. Stephanie, thank you very much. You're very welcome, Stephanie. So that is the end of all the questions we have here, and it is indeed 9:05. So I'm going to invite you guys to join our Facebook forum when you get the link. I'm going to tell you to look for the link so you can watch this over again. You can certainly sign up for this again. They are going to periodically send you emails when we have courses. Some of them are online, and you can attend online. There are a lot of in-person courses coming up. If you're a therapist, I strongly recommend that. You will get a lot out of those courses, and they're not terribly expensive either. So anyway, I'm going to wish you guys a very nice evening. I need to run home and walk my dog and do homework with my kids. So we're going to call it a night. Thank you for coming out, and we will see you next time.